Hi, my name's Dr. Obi. I'm here as your guide about what to expect before surgery, in the operating room, and after surgery. You'll receive a phone call from the preoperative nurse in our pre-admission department a week or so before your surgery. He or she will ask for vital information regarding your health history, including your current active medication list. We would also like to add your email address to your record. You'll receive a phone call the day before surgery informing you what time you need to report to the hospital. Depending upon the type of surgery you're having, you'll arrive to the registration area at a predetermined time. Your vital information, including identifying information such as your name and birth date, will be verified, and this process is repeated throughout your stay to verify your identity and prevent errors. To help provide the very best service, we'll ask for a working email to be given instructions on how to set up MyChart, which allows you a more efficient way to communicate with your provider, ask for medication refills, and schedule appointments. You'll then be directed to the preoperative area, the room where you'll prepare for your operation and to meet your surgical team. If a skin incision is expected to occur as a result of your procedure, a standard skin cleansing preparation will be given to you. You'll be asked to clean your skin after your clothes have been completely removed. Once the skin preparation is complete, you'll have a gown to wear. A nurse will place an intravenous line, referred to as an IV, in preparation for anesthesia as needed. The inside of your nose will be cleaned with a betadine swab, and you'll be given mouthwash to help decrease the harmful bacteria in your nose, mouth, and throat. All of these efforts are directed at reducing infections of the surgical wounds and other possible infections that may arise after surgery and anesthesia, such as pneumonia. Your surgeon will say hello to you and your family or caregivers. The doctor will give you an explanation of the events that are about to take place. Your surgeon will verify the procedure you are about to have. If there is a right or left designation for the operation, you or your surgeon will use a marking pen and write on your skin to confirm the site being treated. You will meet your anesthesiologist, nurse anesthetist, and circulating nurse in preparation for surgery. Once your consents for surgery have been obtained and your questions have been addressed, the anesthesia and surgical team may approve of a mild sedative to produce a calming effect as needed. After the preoperative preparation is complete, you'll be taken by stretcher to the operating room. Although we attempt to keep the operating room at a comfortable temperature, being in a gown may feel cold and vulnerable. As soon as you're moved over to the operating room table, warm blankets are given to assure normal body temperature and comfort. Sometimes these blankets are given in the preoperative area as well. You may encounter bright lights and lots of unfamiliar equipment in the room. The anesthesia team will focus on making you comfortable. Once you're given anesthesia, the circulating nurse and surgeon position your body in preparation for the procedure. Warming blankets, forcing warm air, are administered to portions of the body that did not require exposure to maintain your body's warmth. The skin is cleansed again, and sterile drapes are applied before surgery begins. Before your procedure begins, a formal procedural timeout is conducted to make sure all of the information is correct. Things like your name and birthday, procedure being performed, surgeon performing the procedure, right side or left side if pertinent, antibiotic delivery if needed, and any risks or concerns from any member of the team. Once the checklist is complete, surgery is allowed to proceed. After surgery, you're taken to the recovery room where your vital signs such as blood pressure and finger blood oxygen level are monitored. Pain is treated, and in preparation for transfer to a hospital room or to go home, whichever is most appropriate. The recovery room is a large room with multiple patients also recovering from surgery. Focus on slow, deep breathing through your nose and attempt to create a calming atmosphere to promote recovery. If you're in pain yourself, or if you feel sick from anesthesia or have any other problems, please tell your bedside nurse so he or she can tend to your needs immediately. Depending upon the phase of recovery, your family members may be allowed back to visit with you. This usually only pertains to recovery for patients about to go home. For those staying in the hospital after surgery, your family will meet you in the assigned room after the surgeon has spoken with them. Some patients are given devices called incentive spirometers, or simply spirometers. If you attended our preoperative class, please bring your incentive spirometer with you to the hospital. Incentive spirometers encourage you to breathe deeply after surgery and anesthesia. If you've had surgery on the chest or abdomen, you may not be taking very deep breaths, as this may cause more pain, so instinctively taking shallower breaths may reduce the amount of pain you're experiencing, but it may also cause problems like pneumonia. It seems simple, but after surgery, this can be really difficult to perform, so keep practicing. Walking as much as possible after most surgeries is advised, as this can reduce risks of pneumonia as well as other problems like blood clots. Getting out of bed and walking is a very important step to ensure a speedy recovery. Nurses should assist you when getting out of bed after surgery if you're an inpatient. Many factors contribute to you being unsteady and at a potential risk of falling. Anesthesia, incisional pain, grogginess from medications, IV poles, etc. As instructed, splint your abdomen, turn to your side, take a deep breath, and blow out as you sit at the bedside. Take your time while getting out of bed or a chair. Use the same techniques when you go to the bathroom, as the height of toilets may differ. Be prepared. Avoid holding your breath when moving. Tense muscles may cause more discomfort. The simple act of walking has been proven to have a wide variety of benefits outside from reducing pneumonia and blood clots, including earlier return to bowel function, shorter hospital length of stays, and earlier return to normal function in general. So, even though you may not be feeling your best, getting out of bed to walk can have some really significant benefits. If you stay in the hospital, you'll be visited by a member of your surgeon's team every day. You may also be seeing other doctors depending upon your health needs. Nurses and nurses' aides will be the primary personnel delivering care as you recover and will contact your surgeon about any concerns that develop. A case manager may come talk to you about specific needs you might have at home or in after-hospital care facilities. All of these efforts are directed at providing you with a safe, high-quality experience and minimizing avoidable complications. Thank you for choosing Henry Ford Allegiance Health.